The morning consultation was with the Gene Park and looking on engagement. The Sounding Board have been working with the team, developing an effective communication and engagement initiative, using our own personal reflective experiences to ensure that genomics health services are visible and understood clearly by the public and the patients who are accessing the genomic service. Following our winter consultation, we undertook a piece of work to capture the level of awareness and understanding in the community, and also to review genomics fact sheets and the suitability for the public. Rhiann, Angela and Reese shared the feedback from the collated data. It showed a clear lack of clarity of terms, for example, the genetics, genomics, gene editing and forensics, and that left the public find the scientific terminology rather daunting. There was a good general interest in finding out more about genomics, and particularly from schools and colleges, and also where there is relevancy to lifestyle and medicines and quality of life. The fact sheets we reviewed in relation to their suitability for the public. They were very colourful and factual, incorporating additional links such as videos and further information, but it needed to be more simplified and so that it could be better understood. We were then asked for comments on how we could display this information. And I think the overall overwhelming response was that maybe using the digital screens within healthcare settings, such as GP surgeries, and also within pharmacies and maybe post offices. And also that we should have hard copies available in public meeting areas such as libraries and community centres. Angela Burgess also gave an excellent presentation on pharmacogenomics, looking at understanding how genes affect our response to drugs and how we can incorporate more personalised treatments that can help reduce harmful side effects and give better treatments that are more effective at keeping people healthier for longer. And the second consultation of the day was an interactive presentation by Chris Newbrook, who's Head of Health Sciences with Welsh Government, looking at the draft version of the delivery plan for Wales, which our Sounding Board members have been actively engaging with over the past few months. We also have representation on the steering group for the delivery plan, ensuring that the public and patients' voice was active in its development of the plan and securing meaningful deliverables. The comments we reflected on the delivery plan being a good document with a lot of good work undertaken and maybe a bit too long to appeal to the public as it currently stands. We were understood that the current draft is just a starting point to wider engagement, looking at utilising broader stakeholders groups through actively workshops and future meetings planned. It was agreed that it needed to be a document of intent with costings and timelines and targets to be met if it is to succeed. And the most important thing was evaluation and having a baseline to assess and measure and monitor the progress as we go through the further development of the delivery strategy. The main highlight for me was seeing how all our consultation work with all of the GPW partners has been collectively incorporated into developing the genomics delivery plan for Wales and securing quality genomic services for future generations. And it makes me very proud to have been able to be a part of it.